So just to start off by introducing ourselves, my name's Lisa Hibbard. I advise and support new centres. My role is the National Account Manager, supporting new centres that want to engage with NOCN for endpoint assessment, as well as continue sort of support of account management ongoing sort of through the process as well. We also have Ana Daniels as well, help supporting this session today. She's the EPA technical lead for health and social care, working within our EPA development team. So Anna leads on the development of the assessment instruments and also sort of the guidance documents for the standards in this particular sector. So in this session, I'm going to provide a bit of an overview of the standards that we offer in the sector, and also just provide a bit of information about our support package that we offer to centres in EPA, and also just a bit of an overview of our process. And then I'm going to hand over to Anna. Anna's going to sort of delve into the assessment methods in a bit more detail and discuss how providers can support apprentices to prepare for EPA in these sectors as well. So just to start with then, actually NOCN provide EPA for over 80 different apprenticeship standards. We work in a wide range of different sectors, so things like hospitality, retail, business and management, engineering, construction. So the adult care and health and social care standards is obviously a key part of what we do, fits with our portfolio of qualifications that have just been discussed. And we have that sort of close working relationship with Health Education England, as Lucy Hunt was just sort of indicating before. So in this particular sector, we have sort of those popular standards such as the adult care worker and lead adult care worker. And then there's more specialist ones as well, such as your advanced forensic practitioner, enhanced clinical practitioner, lab technician. The newest standard that we've recently got approval for is the community health and wellbeing worker. So this is a fairly new apprenticeship standard that has been developed with the support with Health Education England. So we do see that this is actually going to become a very popular standard, and one of the ones that Anna will be discussing in more detail that might be of interest to people listening in today. So in terms of our support package, so any organisation that engages with us for endpoint assessment, you get a dedicated point of contact. So you actually have a named person that supports you throughout the process with EPA. We also provide a range of access to sort of mock assessment materials. And we have a robust quality assurance process as well. So NOCN, because of the sectors, a wide variety of sectors that we work in, we work with multiple EQA organisations. So we've had lots of quality assurance visits, and we get really positive feedback from that. Obviously, the quality assurance, external quality assurance will be transferring over to Ofqual, and as an awarding organisation, we have a close working relationship with Ofqual, and also work well with both IFATE and the ESFA as well. We also provide sort of workshops and training for our customers as well. So as part of the package, you can have sessions with the likes of Anna in this particular sector to actually go through and ensure that you have a full understanding of the endpoint assessment, and actually getting those that are involved in the delivery of the apprenticeship, ensuring that they can give apprentices the sort of best opportunity to achieve their EPA, and understand how that they can prepare their apprentices. We do have remote assessment technology available as well. So for the likes of our knowledge tests in endpoint assessment, there's various remote invigilation options available, and we're able to do things such as the professional discussion online as well. So if you want to get more information about the options there, we can provide more detail. We have a 7 working day turnaround of results as well. So we very quick turnaround after the endpoint assessment to provide centres with the results to be able to close off and be able to claim that final part of the funding. So we also have, when centres engage with us, they get an EPA support pack with guidance documents for each of the assessment elements for the particular standard to help them prepare. And finally, we also provide feedback for both sort of successful and unsuccessful attempts at EPA. So if an apprentice has failed, they know what areas can be worked on to improve for a resit. But also because feedback is provided across all apprentices, providers can use it to support improvements on their own delivery if there's sort of common areas that apprentices aren't achieving so well on. So just to give a bit of an overview of the process for centres for engaging with us. The first stage is that you'd need to enter into an EPA agreement with us, confirming us as the selected EPAO for those apprentices. Once that's in place, the first thing that we will do is organise a customer onboarding meeting where you'll get to meet sort of your key contacts with NOCN. You'll get set up onto our rubric platform to be able to access EPA guidance documents and to register learners onto the platform. And then they will also arrange for any setup for sort of ongoing sort of preparation and support, so such as a training session with one of our subject leads for the different sectors that we're working to help sort of prepare for that endpoint assessment. Once the apprentices get to the gateway, there'll be a meeting between the training provider, the apprentice and the employer to confirm that all the on-programme requirements have been met. Any gateway evidence documents are then uploaded into our platform, and then a booking is made for you to sort of schedule in dates for the endpoint assessment, which is then passed over to our scheduling team in order to schedule dates in with the assessors for the endpoint assessment. So the endpoint assessment will then take place, and finally the results and certificates will be issued. So the final results via our rubric platform, and we apply for the certificates on behalf of the learner to ESFA for those to be issued as well. So that's just to give you a bit of an overview of the journey. So I will hand over to Anna now in order to sort of give you a bit more detail about some of the standards specifically in health and social care.
Thank you, Lisa. If you could just change the slides for me, that would be great.
Yeah, okay, I'll do the next slide, please.
Yes, please. Yeah, we'll do that. Next slide, please.
No worries.
Okay, so of all that list, we're going to just go through all the lists that Lisa talked about earlier, and I'm just going to expand on them a little bit. So our lead adult carer and adult care worker is one of our older ones that we've had for a while, and both of them are going currently through a review. So there is going to be some changes very shortly, hopefully, fingers crossed. But currently, what's involved. They've taken away, there used to be a witness testimony on there, but they've now taken that away, so that's no longer required. So all that's required is a self-assessment that is created by or written by the apprentice in their last months of their apprenticeship that supports the professional discussion. There is a situational judgment test, which is a 60 questions and it's done over 90 minutes. And this is basically a multi-choice test based on a scenario and 4 potential answers with 1 correct answer. They are, because the sector is so wide, the scenarios have to be so general. So when the apprentices are going through the training, it's important that they think of all aspects, and the test is there to actually not test them on their specific sector, but test them on the knowledge and skills and behaviours that they should have regardless of which sector they're in. So that those are those transferable skills that they could have in community care, in a residential home, and domiciliary work, or anywhere else that they might work. And it's those questions are set out in such a way, even though it might talk about being in a nursing home and the apprentice is not in, it's the skills that's behind it that they are being tested on. So they should be able to answer all of those questions quite easily, really. Then there is, sorry, I was just reading India's just little note, sorry. So the professional discussion itself is 45 minutes and it is done with some of that self-reflection as well. So the apprentice brings that to the professional discussion. The difference between adult care worker and lead adult care worker compared to other typical standards is that it's not, where like in healthcare assistant practitioner, it's very clear which knowledge, skills and behaviours belong to which assessment method. It's not so clear in adult care worker and lead adult care worker. And although there is that clarity there for some of it, for a whole section of it, there is not. But that's where it comes in, that some of those would be picked up in the self-reflection. Some of it will be picked up as they do in the professional discussion. It should naturally occur, so that they're very tied together, the skills that are missing and the knowledge that it should naturally come out in that discussion. At the present moment, we are just coming to our one of our first with this, even though we've had it on our books for a long time, and we hope to have more in the future. If you have any questions regarding that, because I know how difficult that might be to understand, just please give me an email and I will try and clarify it even more for you. Next one, please, Lisa. So the next one would be healthcare assistant practitioner. When the slide moves. Thank you. Right. As with adult care worker and lead adult care worker, this standard is being reviewed. Although there's not any official date, we are expecting it to be sometime this month, which will be great. If you are interested in seeing what that is looking like, if you go onto the IFA website, it does give you a link to show you what is coming, what is still going to be covered and everything else. But in its, in its official format, we're still waiting for that one and to say that it's a go. But like everything else at this present moment, it's got a multi-choice question test, just in the same way that adult care worker has. It's got an observation. Normally it has an observation. Now this COVID dispensation is still with us until the end of June. And basically, instead of doing the observations, what will happen is that the apprentice will need to write a reflective statement, and that reflective statement has to be validated by an expert witness, and this could be like the manager or their online assessor, as long as we know it's not just a colleague in that sense. And then after that, what will happen is that our assessors will read through it, and then they will have a 30 minutes question with them about what they've written and what the expert witness actually saw work during that observation. So the observation sort of still takes place, but it's, well, let me rephrase that, right? So the observation, that reflective statement, when they're writing it, should be like as if they was in an observation. So it's easy to understand and see what they do on a daily basis or in a particular instance. And that expert witness, if it's their assessor, would have been observing them on several occasions anyway. So we'll know what they're like and whether what they've written is correct. So they will have the opportunity to talk with our assessors before the questions, just so that our assessors have a better understanding of what the apprentice has done. They also have to write a reflective journal, which is all about what they've done, really. I'm sorry, just apologise for 1 minute. I'm sure I've missed something there. Find the right one. Not that one. Not that one. No. Just going through my list here. It's the only one I didn't keep up. Yeah, just bear with me 1 second. I just want to check something because it just feels like there's something missing. At the present moment, because the multi-choice question, it has normal multi-choice, so it has a section of multi-choice questions just like it did in the HAP, but it's also got, that's why, it's also got a like short case studies type of thing where they have to have a long answer to it. And at the present moment, our old Calibrand system was not able to do that. So it is like a physical test that they have. But going forward, our new system is able to do that. So that will be done remotely. Next one, Lisa, please. Lost myself there. Enhanced Clinical Practitioner is still another new one, but not in the same way as the other one. The other one's a little bit more complicated, but this is nice and straightforward. So enhanced clinical practitioners are qualified health and social care professionals who are working at an enhanced level of practice with specific knowledge and skills in a field of their expertise. What they need to produce with is a portfolio of evidence that goes with the professional discussion, and then these reports that go with the quality improvement. So if I just start with the portfolio of evidence, that's compiled during the on-program period and ideally has around 12 pieces of evidence. Now, when portfolios are written, they're written not per knowledge, skills and behaviour, but written more holistically. So one piece of evidence could cover several knowledge, skills and behaviours, which is what is ideal. But it's important that the apprentice has mapped that evidence to those knowledge, skills and behaviours, and all of them are covered in one form or another by the portfolio. Those that are not covered will be picked up in the professional discussion. It is important, though, to know that normally in a professional discussion, we don't have reflective accounts, but in this case we can, but only for knowledge 23 or skills 23. Only on that bit can they give evidence as a self-reflective account. Otherwise, we can't accept any. Well, there shouldn't be any other self-reflective accounts in there. This portfolio is not directly assessed. It's there to support that professional discussion, so underpin it, and they can bring it to the discussion to help them. The quality improvement proposal report with question and answers has 2 parts to it. The first part is that the apprentice will have 4 weeks to develop the quality improvement proposal report before the EPA. That report is a 5,000 word report, which includes tables and figures, and then an annex on top of that. And the project subject and title and scope is something that we will be developing. This has not yet been developed at the minute. So, but it should fully describe an initiative to improve healthcare that they have planned, but may not necessarily have implemented. And the quality improvement proposal report must be realistic in terms of aims and resource requirements and potential for implementation. So basically, even if they've not done anything, what they're proposing is got to be realistic and be something that can be implemented. That's where they get that distinction from. Part of that distinction comes from there. And then they have a 25 minutes question and answer session on that report on one that they've written. The second part which is the second part of that. Then they have to do a 60-minute professional discussion, and that's informed by that portfolio of evidence. That's that one. The lab tech, this is the new version of lab tech, and it's the APO5 version, if you're not aware. It's much improved, in my opinion, from the old lab techs. It's much easier for the apprentice to understand what's happening. It's very similar though in some ways. They have a knowledge test, which is straightforward multi-choice knowledge test. 40 questions over 75 minutes. They have to create a portfolio online, and the portfolio again is not directly assessed, and it's a range of 15 to 25 pieces of evidence. Now, the difference is within that observation, where currently in the old version, the observation you had to have a I forgot the word. But another assessor in there, registered assessor in there, that goes there from, and oftentimes we use them from the company themselves. This time they don't. The assessor, our endpoint assessor, goes in on their own. But prior, and that's that, straightforward as that. And each of them are actually, you can't take some knowledge skills from one method to the next. So you couldn't take any, if they've missed some knowledge or mainly skills in observation or behaviours in observation, they can't take that through to the professional discussion to talk about, to gain it. So they've got to achieve it within that assessment method. So rather than having, that's a straightforward, simple like that, but that instead of that registered assessor, now we need an expert witness, and that expert witness is there only for technical inquiries by our assessor. So if the apprentice is coming on something that we do not have expertise, our assessors do not expertise, like say for instance chemistry, but we do have that, but say for instance it was chemistry, and that portfolio had some new information on ways of working or a new equipment that has been introduced into the sector, and our assessor doesn't know anything about them, that is at that point they will get in touch with the expert witness, and that expert witness will just tell them how that equipment would work, basically. So they just give them that technical advice. It may be that we would request an expert witness from the employer, but we don't know until we know what expertise comes through from and what we've got, and we can match them up and stuff. But basically that's all the role. They don't have to attend, they don't have to do anything. They will have 48 hours to respond to a request, and that's it. And it's all written down. It may be that they have a chat with the assessor if the assessor needs something a little more clarified, but other than that, that is just purely their role. And then it's up to our assessors to then ask the questions during that period. But like anything else, nothing else much has changed. The observation is still all about the performance of a laboratory experiment, test or task, and following those specified methodologies over the 3 hours. That is sort of, except for the hours, there's nothing much changed in there. The portfolio of evidence with the interview is 75 minutes long. It explores the areas of knowledge that would vary between organisations, which is current anyway. And the apprentice ideally should use that portfolio because it supports them to get more in-depth answers, to give more in-depth answers. So it's a nice one now. That is, the lab tech one is a really nice standard to use now. Next slide, please. Advanced Forensic Practitioner. It's a joy. Level 7. And this is for nurses who are wanting to go into court to give evidence. There are 2 assessment methods for this, a practical demonstration and a professional discussion, but it is more involved than that. So we have 2 options for this. We have the custody option and a sexual offence option. The practical, if we just talk about the portfolio before we get onto those 2, the portfolio is built while they're on program, but The portfolio of evidence must be mapped against the UK Associate of Forensic Nurses and Paramedics Advanced Standards in Education and Training and Faculty of Forensic and Legal Medicine, licensed, and cover all the college knowledge, skills, skills and behaviours allocated to the professional discussion. That was a bit of a mouthful. But it's important that the apprentice has mapped that to that all the knowledge, skills and behaviours that come within the professional discussion. And again, it's something that they can take with them and use to support what their answers, right? There's quite a few knowledge, skills and behaviours there, but we only really need 5 pieces of evidence. So again, it's an holistic portfolio, and it certainly needs to be mapped, clearly mapped as well. But if we go back to the practical demonstration, it has 2 components to it. It's got the first component, which is a court statement, and then the second one, which is a cross-examination. So the court statement, what happens is that 3 weeks before the endpoint assessment happens, the apprentice is sent a scenario that, so it's got a scenario in there, and it's got some evidence in there. So if it's like maybe a custody, they might have been sent a custody one where a driver has been arrested because he was drunk and he was driving, and it would be have the arrest, some of the records in, some of the test that was taken, you know, for checking that he was okay, maybe he bumped his head and all of that stuff. So all of that would be in there, including the scenario. And the apprentice would need to write a court statement based on what they've read there. My apologies, 1 second. Molly, shush. Oh, she's just going a bit nutty. Can you all hear me fine over her, or I'll just move her out the room? Can you hear fine, Lisa? Lovely. So they write this court statement, and this court statement can be however long they need it to be. That's not matter, but they need to do it within 2 weeks and return it to us within 2 weeks. So then our assessors will have that 1 week afterwards to actually sift through it, look at it and see what they've done and not done. And then what they do is they come to have a 30-minute cross-examination, and the cross-examination is done by 2 assessors, one acting as defender and one acting as a prosecutor, and it will be as mirrored as possible to what they would expect to receive in court. They currently what we're going to be doing is doing this remotely. So it will be done like on Teams, but everything else should look as though it's been done remotely in court as well, you know, like when they have those remote links. When training providers come, whether we will do it face to face will depend upon a lot of different variables, like whereabouts the apprentices are, what rooms are available to us, and all of that. But that's a longer discussion to have on a one-to-one basis. But we're open to that discussion. So after that, they will then have a professional discussion, and the professional discussion is just, you know, covering all those elements within the portfolio. That's that one. Next. Right, and this is our last one. This is more complicated than any others, but it could be a very interesting one to have, and we're still in the development stage of this too. So again, it's got a multi-choice test, demonstration of practice, and a professional discussion underpinned by a portfolio of evidence. So if I start with the portfolio of evidence, it's slightly different. A normal portfolio of evidence, you'd evidence what you're doing against your knowledge, skills and behaviours within that professional discussion. However, this is not quite like that. In this case, your portfolio of evidence will contain typically a minimum of 3 case studies undertaken through the course of the apprenticeship, including a record of where these have been observed in practice. These case studies should include examples of how the apprentice has supported individuals and how they have worked with and for local communities. And the case studies each should be a maximum of 1,000 words, be structured as background issues, you know, like a proper case study, be considerate of GDPR rules, and then sent in to us. And that case study is not directly assessed, it's there again to underpin that portfolio of evidence. It's going to be interesting to have all those come back to us, because every single one will be slightly different, because the way that they work in community, there's different settings. So that would be really interesting to read. The multi-choice test is 30 standard multi-choice questions, and they have 45 minutes to complete that test, just like normal. This is the demonstration of practice is where it gets interesting, and this is where they can get that distinction, right? So imagine this being a physical one face-to-face. There would be 3 sections that they have to go through. So in the standard, you'll see them called station. So I'm just going to refer to them as stations. So station 1, so they'd have that first slot, and they'd have 30 minutes to they'll have a scenario, they'll have maybe somebody in there, and it's all about service users issues. So they'll have a 30 minutes question backwards and forwards about that. Then from that, they move on to the second part, the second station, which is 40 minutes, and that's all about a community issue. And they might see in there, let me just check which ones are in there, just to clarify up there. So they have, get back down to the stations, just to clarify it a little bit more for you. So, oh, missed it. Get down, right. Just got to get down to my stations. My apologies. Right. So, in station 1, this service user issue, there will be the assessor, the apprentice, and an actor who's acting as the service user. And they have to assess, so it's all about the first meeting, has to assess and identify what the issues are, make appropriate notes, and work with the service user to co-produce an action plan to address their priorities. And they have that 30 minutes to do that. And then they move on to the community issue, which is based on a scenario, and it's involving a community group or organization. And the apprentice will present to the assessor the actions that they will take to deliver on agreed community outcomes, and drawing on their experience in their area of practice, how they would collaborate with a different range of stakeholders and partner agencies, explaining reasons behind their actions. Then station 3 is another service user issue, and the apprentice will work alongside a service user, which is another actor who is already partway through their action plan to follow up on issues and actions taken that have been discussed in an earlier appointment. So potentially it's more than likely that we'll link station 3 and station 1's together in some way. So they'll take that same person that they talked about in station 1 and talk about, like, 6 months down the line, what has happened with that person and how it is, so that they can follow through that whole experience that they would have had with one service user, instead of using a different service user, just so it gets a little less complicated for them. But then they go on to that professional discussion, and that professional discussion is again about those, just double checking that I've got it right. It's for 60 minutes. And it will be underpinned by that portfolio that they've done, and what's in that portfolio will help our assessor to develop those questions that they're going to ask, rightly. So that's it, really, at this present moment in time. If you have any questions, just let me know, ping them over, and I'll answer them. Lisa, back to you.
Yeah, thanks, Anna. Yeah, just to say, if there's any more sort of questions, you want more information about any of those specific standards or processes and things with EPA, so feel free to get in touch with us after this session. Okay, thank you.